more people are beginning to question the long held belief that strength means suppressing emotions.
What we are really talking about is how society teaches men to relate to emotion, vulnerability, support. For example, I was having a conversation with a particular HR, right? And they mentioned that they literally booked around 200 one-to-one therapy sessions for their employees, made it available for the employees, but not even a single employee actually made use of those services without a question. The future of mental health is not crisis response, it's early intervention. The institutions that will create the greatest impact are not necessarily those that respond most effectively after a problem emerges. They are the institutions that create environments where problems are identified and addressed early. What often gets missed is that emotional distress does not always look like emotional expression. Sometimes it looks like disengagement, overachievement, or even silence, while emotionally struggling. They attend meetings, they complete tasks, they meet deadlines, yet internally, they may feel disconnected, exhausted, or over. Because these individuals continue performing, institutions often assume everything is fine. So leaders play a very crucial role, not because they need to become mental health experts, but because they influence the environment in which people operate. The most effective institutions are often not those with the largest resources, but those that intentionally create environments where people feel seen, supported, and safe enough to seek help when needed.
Welcome to the podcast. I'm your host Nitya. Today we are discussing a topic that is increasingly being recognized as a mental health concern, but perhaps not being addressed as a systematic challenge. Men's mental health. Why it's okay for men to cry. So, over the last few years, conversations around mental health have become more mainstream. So, the organizations are investing in employee well-being. Educational institutions are talking about student mental health. Communities are becoming more aware of emotional well being. Yet, despite the progress, there seems to be one area where silence still dominates the conversation: how men experiences and express emotional distress. So, in recent years, conversations around masculinity, loneliness, emotional vulnerability, and men's well being become more increasingly visible across social media, workplaces, and educational spaces. More people are beginning to question the long held belief that strength means suppressing emotions. So, as a result, men's mental health has become an important and sometimes controversial topic of discussion. What's interesting is that is not simply an individual challenge. When men struggle to express emotions, seek support, or acknowledge vulnerability, the consequences often extend far beyond the individual. We see the impact in classrooms, workspaces, families, leadership teams, and communities. A student who feels unable to ask for help may struggle academically. An employee also who believes they must always appear strong may carry stress until it becomes burnout. A leader who never learned to process emotions may unknowingly create cultures where emotional well being is viewed as a weakness rather than a strength. So, while men's mental health is a personal issue, perhaps the more important question is whether we should be looking at it as an educational issue and ultimately a societal issue. To help us unpack this, I am joined by someone who has spent years working at the intersection of mental health, psychotherapy, and ecosystem development. Joining me today is Nitin Sir, CEO of ICHARS and Director of ICHARS Support Foundation, an organization working towards strengthening mental health awareness, capacity building, and accessing to support across communities and institutions. Nitin sir, welcome to the podcast.
Thank you, Nitya. I'm glad we are having this conversation because I think men's mental health is often misunderstood. When people hear this phrase, men's mental health, they immediately think about emotional expression, or whether men should be more open about their feelings. While those are important conversations, they represent only a very small part of a much larger picture. What we are really talking about is how society teaches men to relate to emotion, vulnerability, support, and help seeking. Those lessons don't just affect individuals, they shape how students engage in educational environments, how employees function in workplaces, how leaders make decisions, and how communities respond to emotional distress. And that's why I believe this topic deserves attention not only from mental health professionals, but also from educators, HR leaders, community organizations, and institutions that are responsible for supporting people's well being.
I think that's an important distinction because when we discuss mental health challenges, we often focus on what individuals should do directly. But when a pattern appears consistently across schools, workplaces, and communities, it suggests that there may be larger systems and cultural narratives at play. And when those systems influence how people perceive emotional expression, vulnerability, and help seeking, the conversation naturally becomes much bigger than any one individual. So, in today's discussion, I would like us to explore not only why men often struggle to express emotions, but also what this means for institutions, communities, and the broader mental health ecosystem. I would also like us to examine why this issue continues to persist despite growing awareness around mental health, what organizations may be overlooking, and what meaningful solutions could look moving forward. Nitin sir, let's begin by understanding the issue at its root. Why do you think conversations around men's mental health remain so difficult, even at a time when mental health awareness has never been higher?
So, I think there are several reasons for that. Perhaps the most important thing to recognize is that awareness and transformation are not the same thing. Over the last decade, awareness around mental health has undoubtedly increased. More people know the language of mental health, more organizations are willing to discuss well being, more educational institutions acknowledge the importance of emotional well being and emotional health. But awareness does not automatically change deeply embedded beliefs. Many men today are aware that mental health matters. They understand concepts like stress, anxiety, burnout, and emotional well being. Yet, they may still struggle to apply their awareness to themselves. The reason is that cultural conditioning often operates at a much deeper layer or level than information. For generations, many boys have grown up receiving messages that equate strength with self reliance. As a result, many men learn that seeking support is something to postpone rather than prioritize. From a mental health perspective, that creates a significant challenge because emotional difficulties are often addressed much later than when they should ideally be.
That raises an interesting contradiction. On one hand, organizations increasingly talk about psychological safety and employee well being. On the other hand, many men continue to believe that showing vulnerability could affect how they are perceived. In other words, awareness may have changed faster than culture. Do you think institutions sometimes underestimate the influence of culture on mental health outcomes?
That's true. And it's actually not just institutions. In general, many of us underestimate the importance of culture on mental health. It's one of the most overlooked factors in mental health conversation. Organizations frequently focus on programs and policies, which are important. However, culture determines whether those initiatives are actually utilized. For example, a workplace may provide access to well-being resources, but if employees believe that discussing emotional challenges could be interpreted as weakness, utilization remains low. For example, I was having a conversation with a particular HR guy, and they mentioned that they literally booked around 200 one-to-one therapy sessions for their employees. made it available for the employees, but not even a single employee actually made use of those services. So it's not that those initiatives are not in place, they may be, but for some reason, people were not even comfortable seeking an initiative that was available to them. Similarly, educational institutions may invest in student support services, yet students may hesitate to access those services if they fear judgment or stigma. The same pattern appears in communities. The resources may exist, the support may exist, the awareness may exist, but the culture surrounding help seeking prevents people from engaging with those resources. Leaders need to pay attention to not only what support systems are available, but also to the messages their institutions communicate about emotional well-being and about seeking it.
That's a valuable perspective because it shifts the conversation from individual behavior to institutional responsibility. When we think about schools and colleges specifically, many conversations around student success continue to focus on academic achievements, employability, and performance outcomes. Yet, emotional well being often receives attention only when a crisis emerges. How does emotional compression among young men affect educational environments in ways institutions may not immediately recognize?
So, one of the biggest misconceptions is that emotional well-being and performance are separate domains. In reality, they are deeply interconnected. Students do not leave their emotional experience outside the classroom. A young person dealing with chronic stress, self doubt, loneliness, social pressure, or emotional isolation carries those experiences into their learning environment every day. When emotional challenges remain unaddressed, institutions may observe symptoms without recognizing the underlying cause. They may see declining engagement, reduced participation, difficulty concentrating, increased absenteeism. Their academic performance may be affected and there may be visible behavioral concern. What is often missed is that emotional well being frequently sits beneath any of these outcomes. The challenge becomes even greater for young men because many have been socialized to internalize struggles rather than communicate them. As a result, distress may remain invisible until it begins affecting educational performance or overall well being.
Imagine a similar dynamic exists in workplaces. Many organizations today are dealing with burnout, disengagement, retention challenges, and increasing well being concerns. And these issues are often discussed primarily through productivity metrics rather than emotional well being. Are organizations sometimes measuring the consequences without understanding the causes?
I think that's an accurate observation. Organizations often become aware of problems when they appear in measurable forms. Higher turnover, lower engagement, increased absenteeism, reduced productivity, maybe leadership fatigue, or team conflicts. Those indicators are important. However, they often represent the outcome of the underlying psychological or emotional challenge that have been developing for a much longer period. When emotional well being is neglected, people don't necessarily stop functioning immediately. Many continue performing while carrying significant levels of stress, pressure, exhaustion, or emotional isolation. The challenge is that sustained emotional suppression eventually affects decision making, relationships, creativity, resilience, and performance. That is why mental health should not be viewed solely as a well being initiative. It is also an organizational effectiveness issue.
What's interesting is that whether we are discussing schools, colleges, or communities, the pattern seems remarkably similar. The visible problem often appears much later than the invisible struggle. And that makes me wonder whether many institutions are still operating reactively rather than proactively. Instead of waiting for burnout, disengagement, crisis, or distress to become visible, should leaders be thinking more seriously about prevention?
Without a question. The future of mental health is not crisis response, it's early intervention. The institutions that will create the greatest impact are not necessarily those that respond most effectively after a problem emerges. They are the institutions that create environments where problems are identified and addressed early. That requires awareness. It requires emotional intelligence and part of the leadership. It requires psychologically safe culture. It requires conversations that normalize support seeking. And perhaps most importantly, it requires recognizing that emotional well being is not separate from organizational success, educational outcomes, or community development. It's a foundational component of all three.
I think that's powerful insight and perhaps a fitting place to pause before we move deeper into the discussion. Because if emotional well being influences everything from learning outcomes to workplace, culture, and community resilience, then the next question becomes equally important. How do institutions recognize when people are struggling, especially when those struggles remain largely invisible? Let's explore that next.
So, I think that's one of the most important questions organizations need to consider. Many people associate emotional distress with visible emotional expression. They expect someone who is struggling to openly communicate their challenges or display clear signs of vulnerability. However, for many men, distress often manifests differently. Instead of expressing emotions outward, they may become increasingly withdrawn, emotionally unavailable, irritable, overly focused on work. They may get disconnected from relationships or may become excessively self reliant. What's particularly challenging is that some of these behaviors are often rewarded in institutional environments. For example, a student who quietly keeps difficulties to himself may be viewed as independent. An employer who works excessively despite exhaustion may be praised for commitment. A leader who never discusses personal challenges may be perceived as resilient. Yet beneath those behaviors, there may be significant emotional strain. The problem is that institutions frequently recognize the consequences before they recognize the cause.
That's a fascinating observation because it suggests that some warning signs are actually mistaken for strengths. A student who never asks for help, an employee who never takes a break, or a manager who appears unaffected by pressure may seem like ideal performers. Yet, those same patterns could indicate that someone has learned to compress rather than process what they are experiencing. How does this plays out in educational settings specifically?
So, educational institutions occupy a particularly important space because many emotional patterns are formed during adolescence and early childhood. Students today face a combination of academic pressure. As a result, institutions may observe declining participation, social withdrawal, reduced engagement. They may notice behavioral changes, like you mentioned earlier, absenteeisms. There may also be a sense of or a need for perfectionism or an increased risk taking behaviors without immediately connecting them to emotional well. What often gets missed is that emotional distress does not always look like emotional expression. Sometimes it looks like disengagement, overachievement, or even silence. This is why education institutions need systems that go beyond academic performance and actively consider student well-being as part of overall development.
That distinction between performance and well being is important. In many cases, institutions are evaluating outcomes while missing the experiences driving those outcomes. A similar pattern seems to exist in workplaces. Many organizations invest heavily in productivity, performance management, and employee engagement. Yet, burnout remains a growing concern. What are organizations potentially overlooking?
One of the biggest challenges is that burnout is often treated as an individual problem rather than an organizational signal. When employees experience chronic stress, emotional exhaustion, or psychological strain, the response frequently focuses on helping individuals become more resilient. While resilience is valuable, it doesn't address the conditions contributing to the problem. Organizations need to ask broader questions. What expectations are employees operating under? How safe do they feel discussing well-being? Do leaders model healthy behavior? Are support systems visible and accessible? Do managers know how to recognize early signs of distress? Many employees continue functioning while emotionally struggling. They attend meetings, they complete tasks, they meet deadlines, yet internally they may feel disconnected, exhausted, or overwhelmed. Because these individuals continue performing, institutions often assume everything is fine. Unfortunately, by the time visible consequences emerge, such as disengagement, conflict, turnover, the challenges have often existed for a considerable period of time.
What's striking is that whether we are discussing students or employees, the issue seems less about recognizing crisis and more about recognizing subtle shifts before crisis occurs. I imagine this challenge becomes even more complex in NGOs and community organizations, where people are often supporting others while dealing with their own emotional burdens.
True. Many professionals working in community settings, social impact organizations, and nonprofit sectors carry significant emotional responsibility. They engage with vulnerable populations, navigate resource limitations, respond to crises, and often work in environments where the need of others take priority. Over time, this can create emotional fatigue, compassion fatigue, or even burnout. What's concerning is that individuals who dedicate themselves to helping others sometimes become the least likely to prioritize their own well being. Similarly, beneficiaries and community members may experience emotional challenges that remain unaddressed because mental health is still viewed through the lens of crisis rather than prevention. That is why community well being must be viewed as a systemic issue rather than simply an individual concern. Mental health influences participation, engagement, resilience, social cohesion, and the overall effectiveness of community initiative.
That brings us to the role of leadership. If many of these warning signs are subtle and if emotional distress often remains hidden behind performance or responsibility, then leaders become incredibly important. Yet many educators, managers, HR professionals, and community leaders may feel uncertain about what their role should be. What responsibility do leaders actually have in addressing these challenges?
So, leaders play a very crucial role, not because they need to become mental health experts, but because they influence the environment in which people operate. A leader's responsibility is not to diagnose problems, obviously. They are not trained mental health practitioners. Their responsibility is to create conditions that means fostering cultures where well being conversations are normalized rather than stigmatized. It means paying attention to behavioral changes rather than waiting for crisis. It means equipping managers, educators, and supervisors with skills to recognize warning signs and respond appropriately. Most importantly, it means understanding that mental health is not separate from organizational effectiveness. It influences learning outcomes, workplace performance, community engagement, attention, collaboration, and leadership capacity. The institutions that recognize this connection are often far better positioned to support both well being and long term success.
That's a powerful shift in perspective. Instead of asking, how do we respond when someone is struggling? Perhaps institutions should also be asking, what kind of environment are we creating that either encourages or disencourages people from seeking support? If awareness alone is not enough, and if leaders have a role in shaping healthier environments, what do effective solutions actually look like?
So, for many years, mental health conversations have focused on reducing stigma and increasing awareness. Those efforts are important because they help bring previously ignored issue into only starting point. The real challenge is creating an environment where awareness can translate into action. When we look at institutions that are making progress in this area, one common pattern emerges. They stop treating mental health as a standalone initiative and begin integrating it into the way the institution functions. In educational settings, this means recognizing the emotional well being and the fact that this emotional well being is connected to learning outcomes, student engagement, retention, and overall development. In workplaces, it means understanding that mental health is linked to productivity, innovation, collaboration, leadership, effectiveness, and organizational sustainability. In communities, it means acknowledging that emotional well being influences participation, resilience, social cohesion, and overall quality of life. The organizations that are seeing positive outcomes are not necessarily doing one extraordinary thing. They are consistently embedding well being into their system, policies, leadership practices, and culture.
That's an important distinction because many institutions still approach mental health as an event rather than an ecosystem. A well-being week, a stress management session, a single awareness campaign. While those initiatives have value, they don't necessarily change the environment people operate within every day. So, what separates organizations that create lasting impact from those that simply run well-being activities, sir?
So, before I answer, institutions approach mental health as an event rather than as an ecosystem. Is just perfect in the way things are going on right now. It's important that organizations start exploring well being not as a destination, but they understand that it's an ongoing process. Sustainability is extremely important in any mental wellness initiative. For example, schools and colleges that effectively support student well being usually create multiple layers of support. They invest in awareness, but they also build systems for early identification, referral pathways, faculty sanitization, peer support, and ongoing engagement. Similarly, workplaces that prioritize mental health successfully don't rely solely on employee well-being campaigns. They examine workload expectations, leadership behaviors, communication practices, psychological safety, and organizational culture. In other words, they address both individual supports and systemic conditions. If we focus only on helping people cope without addressing the environment contributing to the distress, our impact remains limited.
That raises an interesting challenge for leaders. Many leaders genuinely want to support well being, but they may not always know where to begin, particularly for schools, NGOs, and organizations operating with limited resources. The idea of building a mental health ecosystem can feel what could be a practical starting point, sir?
So I would suggest begin with three questions. First, do people feel safe talking about challenges? Second, do people know where to seek support? And third, do leaders know how to respond when concerns arise? These questions may sound simple, but they reveal a great deal about an institution's mental health culture. If individuals fear judgment, support systems often remain underutilized. If referral pathways are unclear, people delay seeking help. If leaders feel unprepared, opportunities for early interventions are frequently missed. Many organizations assume they need extensive infrastructure before they can make progress. In reality, meaningful change often begins with improving conversation, increasing mental health literacy, and strengthening existing support mechanisms.
You mentioned early intervention, and that seems particularly relevant to men's mental health. One of the recurring themes throughout our discussion has been delayed help seeking. Many men seek support only after challenges have become severe. How can institutions encourage earlier engagement with support systems?
approaches is normalizing help seeking before crisis occurs. Historically, support has often been framed as something people access when they are struggling significantly. The problem with that approach is that it reinforces the idea that seeking help is the last resort. Instead, institutions can encourage a broader understanding of mental well being. Just if people invest in physical health before serious illness develops, emotional well being can also be approached proactively. This is where coaching, mentoring, peer support, counseling services, well being programs, and mental health education can play a very important role. The objective isn't simply to respond to problems, it's to create opportunities for reflection, growth, and support before difficulties become overwhelming. When organizations normalize these practices, help seeking becomes a part of healthy functioning rather than an indicator of crisis.
Accessibility is another important aspect of this conversation. Even when people are seeking support, barriers often exist. Whether it's affordability, availability, or uncertainty about where to begin, many individuals still struggle to access.
So, accessibility is one of the most important issues in mental health today. A support system is only effective if people can actually access it. Many institutions focus on creating resources, but less time is spent on understanding barriers. Can people find support? Do they understand how to access it? Do they trust the process? Is the support affordable? Are referral pathways clear? These questions are critical. Institutions don't necessarily need to provide early service directly. However, they can play a significant role in improving access through partnerships, resource directories, awareness initiatives, referral systems, and supportive policies. The goal should be reducing friction wherever possible. Because often the difference between someone receiving support and someone continuing to struggle is not willingness, it's accessibility.
Something that stand out throughout this discussion is that sustainable mental health system seems to depend on collaboration. No single department, leader, educator, manager, or organization can solve these challenges alone. Would it be fair to say that the future of mental health support lies in building stronger ecosystems rather than isolated interventions?
So I would agree with that to an extent because both are important. Isolated interventions are also extremely important, and so are stronger ecosystems. That said, mental health challenges are complex because they're influenced by multiple factors simultaneously: social, educational, organizational, economic, cultural, and personal. As a result, solutions also need to be collaborative. Educational institutions, workplaces, community organizations, mental health professionals, policymakers, and leaders all have an important role to play. The most effective systems are those that create connections between these different stakeholders rather than operating in isolation. When awareness, support, leadership, accessibility, and community engagement work together, mental health becomes part of the ecosystem rather than an afterthought. And ultimately, that is how sustainable change occurs. Not through isolated programs, but through environments that consistently support human well.
Because if emotional well being is influenced by systems, then the solution must also involve systems. And perhaps that's the shift we need to make from asking how individuals can cope better to asking how institutions can create conditions where people are more likely to thrive. As we move into the final part of our conversation, I would like us to bring these ideas together and discuss what collective actions could look like across institutions, communities, and the broad mental health ecosystem.
So I think the most important message is that men's mental health should not be viewed as a niche well-being issue. In fact, why only men's mental health? We can actually expand this to mental health in general. It's an educational issue, it's a workplace issue, it's a community issue. And ultimately, it is a societal issue. When boys grow up believing they must suppress vulnerabilities, educational institutions experience the consequences through disengagement, stress, reduced health seeking, and emotional isolation, as we discussed earlier. When employees feel unable to acknowledge emotional challenges, organizations experience the consequences through burnout, reduced productivity, leadership fatigue, and workplace conflict. When emotional well-being is overlooked within communities, NGOs, and social systems, the effects can influence participation, resilience, social cohesion, and overall community well. So the question is no longer whether institutions should care about men's mental health. The question is how they choose to respond. Because whether we acknowledge it or not, men's mental health already influences educational outcomes, workplace effectiveness, community development, and social progress.
That's again a powerful shift in perspective. Instead of asking whether mental health belongs within institutional conversations, perhaps we should be asking why it was ever excluded from them in the first place. And throughout today's discussion, one theme has consistently emerged: responsibility. Not responsibility placed entirely on individuals, but responsibility shared across systems, institutions, leaders, and communities. What role do you believe institutions need to play moving forward?
So I believe institutions have a unique opportunity to become catalysts for change. Educational institutions shape how young people understand emotional well-being. Workplaces shape how adults experience support, belonging, and psychological safety. Community organizations influence how people access resources, seek support, and engage with one another. This means institutions are not simply observers of mental health challenges. They are active participants in shaping mental health outcomes. The most effective institutions are often not those with the largest resources, but those that intentionally create environments where people feel seen, supported, and safe enough to seek help when needed. That can involve leadership commitment. It can involve awareness and education, involves strengthening referral pathways, improving access to support. Most importantly, it involves recognizing that mental well-being is not separate from organizational success. It is a part of the foundation upon which sustainable success is built.
And that's where organizations working within the mental health ecosystem become important partners in creating that change. Before we conclude, I would like to briefly discuss how organizations can engage with the broader mental health ecosystem and where institutions can begin if they want to strengthen their effort in this area.
So, one of the biggest lessons we have learned across the mental health sector is that meaningful change requires collaboration. Like you mentioned earlier, no single school, organization, NGO, community group can address these challenges alone. Progress happens when institutions, mental health professionals, community leaders, educators, and organizations work together towards a shared goal. This is where organizations such as ICHARS Support Foundation contribute to the broader ecosystem. Through awareness initiatives, educational programs, workshops, trainings, support groups, internships, practitioner development efforts, and community engagement activities. The focus is on strengthening mental health literacy, capacity building, and access to support across different sectors. The objective is not simply to respond to mental health challenges after they emerge, but to support prevention, early intervention, and sustainable well-being systems. Equally important is contributing to the quality of support available within the mental health ecosystem by strengthening practitioners' competencies, promoting evidence informed approaches, and supporting the development of skilled professionals who can effectively serve individuals, institutions, and communities. There are also ongoing efforts to improve awareness around available mental health resources, strengthen support networks, and help make professional mental health support more accessible and easier to navigate for individuals and institutions seeking guidance.
Accessibility is an important point because even when awareness exists, access often remains a challenge.
That's true. Many individuals and institutions recognize the importance of mental health but may struggle with practical barriers such as awareness of available resources, affordability, accessibility, or knowing where to begin. This is where conversation around accessible and affordable support pathways remain important.
Before we close, I would like to ask one final question. If there are school leaders, college administrators, HR professionals, NGO leaders, CSR teams, and community stakeholders listening today, what is one action you would encourage them to take after this conversation?
I would encourage them to begin with a few simple questions. Ask yourself, what role does mental well being currently play within your institution? Not what role it should play, not what role it might play in future, but what role does it play today? Are conversations around well-being encouraged? Do people know where to seek support? Do leaders understand the importance of psychological safety? Are systems in place to support early intervention? Are we creating environments where people can thrive rather than merely cope? The answers to those change can begin. The encouraging reality is that institutions do not need to solve everything at once. Small intentional steps can create significant long term impact.
I think that's a fitting note to end on. Today's conversation has reminded us that men's mental health is not simply about emotional expression. It's about creating culture, systems, and environments where people feel able to acknowledge challenges, seek support, and contribute meaningfully to their communities. It's a conversation that belongs in classes, colleges, workplaces, NGOs, leadership meetings, and community spaces. Because when we institutions invest in mental well being, they are ultimately investing in people. And when people thrive, organizations and communities thrive as well. Nitin sir, thank you for sharing your insights and perspectives with us today.
Thank you, Nitya. It has been a meaningful conversation, an interesting one for me. And to everyone listening, meaningful change rarely begins with large scale transformation. More often, it begins with awareness followed by action. So go ahead, take out the learnings, the meanings that you can from this particular conversation. And I hope this conversation would initiate some shift in you to be able to carry forward this shift in your life, in your organizations, in your education institutions, wherever you're working and whomsoever you're connected with. Thank you. Thank you for listening and looking forward to the next podcast.